The OpConfirm screen is a new feature which will allow BSR-i users an easy and streamlined approach to entering data. OpConfirm screens contain the patient and operation details, which have been bulk loaded in the BSR-i from participating hospitals' ICD-10 ACHI data reports. The OpConfirm screen can be accessed from the Worklist menu bar, or by clicking on the OpConfirm button in the message on the dashboard. The OpConfirm screen displays data obtained from the hospital ICD-10 ACHI records, specifically the patient's demographics, the operation date, the hospital, the surgeon or gastroenterologist who performed the procedure, and the operation type. Complete the remaining operation data. Select the primary, planned revision or unplanned revision for the procedure performed. If you selected unplanned revision, the menu for reason will appear. Enter the patient's height in meters to 2 decimal places. Check the surgical approach, as the default setting is laparoscopic. Enter the patient's weight at the first consultation. Enter the patient's weight at the time of the operation. Select the correct option of yes or no or not stated from the drop-down list options. If you have selected yes to diabetes status, then you'll be required to tick the correct treatment that the patient is receiving. Renal or liver transplant. This field is defaulted to no, but select yes if a renal or liver transplant was performed as a concurrent operation. Enter device information regarding the stapling and/or devices used with the operation, unless the procedure was one of the revision operations which can be included. Enter the vital status. If the patient died, any cause, in the 90 days since their operation, select deceased from the drop-down menu. After selecting deceased, enter the date and detail the cause of death if known. Please complete the field to the best of your knowledge. You are also asked to describe the likelihood that the death was related to the surgery. Select the most appropriate, otherwise the default field is not yet determined. Complete the peri-op follow-up. Peri-op follow-up date. The date of the surgery is pre-filled for your reference. The date you enter must be between 20 and 90 days after surgery. The follow-up date selected should be either the actual date of following up with the patient or the date when you can confirm that the patient had none of the above issues. You are asked to please not complete the perioperative follow-up as BSR to follow-up. Surgeons and gastroenterologists should be aware of how their patients are faring following their operation. Tick if any defined adverse event occurred in the 90-day postoperative period and indicate the reason. The bottom of the screen gives the following options: Submit and Next. By clicking this button, you can submit the current operation and/or perioperative follow-up and move on to the next record. Skip and Next. By clicking this button, you can skip the current operation submission and move on to the next record. Cancel. At any point in time, clicking this Cancel button takes you to the patient search screen.